Scientists are saying it really is not a matter of if, but when there might be a second roll of coronavirus cases in our country. And of course, Florida's part of our country, so we'd feel it here too. But with Southwest Florida's numbers continuing to grow, although not exponentially anymore, some healthcare professionals are still bracing for that second round. 4 in Your Corner's Rachel Lloyd spoke with a local epidemiologist who studies disease, who says we need more data before we reopen fully. Rachel?
He says what we're missing in the U.S. is basic research, tracking down who has it, who doesn't have it, and who will likely get it next.
We controlled the first wave with what I call a sledgehammer approach.
Dr. James Copeman, an epidemiologist at the University of Michigan, calls stay-at-home orders more reactive than proactive. But he says solid research can better prepare the U.S. for what he calls the inevitable second wave of COVID-19.
We have to have good epidemiologic studies, and we have to have good data, so we know where the virus is going, what areas have been hit, what areas haven't been hit.
Southwest Florida now has more than 1,000 cases and 30 deaths. Copeman doesn't see the next round of cases coming from abroad like other countries have reported, but says the U.S.'s 500,000 cases, exceeding any other country, are enough to reemerge the virus in the fall if we're not careful.
It is not going to go down to zero. It's going to go down to some low level that can rekindle everything else.
Tom Smythe, finance professor at Florida Gulf Coast University, told me the U.S. is likely already in a recession, and getting people back to work will ease pressure on government funds, but it could backfire on the economy.
There is a benefit to sort of waiting a little bit longer to make sure we don't sort of jolt the consumer's confidence.
And healthcare workers support keeping things closed.
Everybody in the healthcare profession is concerned about a second wave.
Isabel Francis is a registered nurse for Lee Health. She doesn't work directly with COVID-19 patients, but sells PPE gear like these masks for doctors and nurses who do. And Dr. Copeman says reopening should be gradual, analyzing places that show declining numbers first and using that as a model to reopen other areas. He also recommends tracking those with COVID-19 and everyone they've come into contact with and possibly quarantining those people. Rachel Lloyd, Fox 4 in Your Corner.